I'm Dr. Scott Rossi. I'm chairman of Oral Health and Diagnostic Sciences and director of the Clinical Center for Oral Medicine. Most of the commercially available dry mouth products tend to be insufficient to actually provide long-term relief for patients. Many of them are expensive and they provide just temporary or transient relief of their dry mouth symptoms, and patients are always seeking new and novel therapies to improve not only their quality of life but how their mouth feels, to prevent disease, prevent dental problems, but most importantly maybe even to prevent the progression of disease that sometimes can be causing their dry mouth, such as Sjogren's syndrome. Well, there are plenty of products currently on the market, but most of them are insufficient, which is why patients tend to try multiple things, and they often have a limited selection commercially, honestly. They can actually go online and find products, but when they go into the store, there are very few products that actually help with their symptoms for as long as patients like. So they're always searching for new and novel ways to improve their oral cavity and oral dryness. Based on our preliminary results, we are very, very pleased with how effective the MighTeaFlow product is, not only in improving how people's mouths feel, but actually in improving the amount of saliva that they can produce. And it's been very exciting because it's been very well received. Patients feel that the product is extremely easy to use, it tastes great, it makes their mouth comfortable, and it helps. And not only does it help for the short term, it actually provides some long-lasting relief. So I feel this will absolutely be the leader in the field in terms of dry mouth care. Neutral pH is vitally important. Many of the currently commercially available products actually have very low pH, and natural saliva has a pH that's relatively neutral, and many of the products that are commercially available have acidic pH. And the acidic pH is what leads to dental decay and deterioration of enamel. So folks that have a dry mouth are susceptible to having decay and cavities and caries to begin with, and then to add a product that has a low pH almost adds fuel to the fire, where this product actually has a stable pH, a neutral pH, which is going to not only improve their oral cavity in terms of dryness, but have a protective effect on their dentition and teeth. Well, there are lots of different options for them, and we recommend they use all of them: the lozenges, the gum, the spray, and the mouthwash, because each of them is going to work differently. For instance, just having a lozenge and a gum in their mouth provides mechanical stimulation, which increases liquid, increases oral comfort. The mouthwash can be used obviously for patients that have dryness, that are going to provide them an opportunity to cleanse their oral cavity. And the sprays are convenient because throughout the day they can keep it in their pocket or purse, and at a moment's notice when their mouth feels dry, give themselves a squirt or two and their mouth feels perfect. What sets MighTeaFlow apart from many of the competitors is that it's an all-natural formulation. It contains xylitol, but also extracts from green tea, which are potent antioxidants. And not only does it make people's mouth feel better, it makes their mouth better. Unlike some of the prescription medications that we use for folks with dry mouth, which can cause sweating and difficulty with bowel movements and even complications with heart disease, this has no side effects. And so patients tolerate it well. They absolutely love the way it tastes, and it's extremely well tolerated. So the neat thing about it is when we give this to patients, which we do with all of our dry mouth patients, we'll provide samples for them, how positive, overwhelmingly positive the response is when they come back and say just how wonderful the product tasted, how wonderful MighTeaFlow made their mouth feel, how much increased saliva they had, and how much more comfortable and how improved their quality of life has been. It's really been, for many individuals, a welcome change from many of the products that they have used in the past. The development of MighTeaFlow really began as benchtop research that grew into a bedside or chairside implementation with a randomized controlled clinical trial that we developed. Initial studies in mouse models showed benefit, and we were able to develop a clinical trial that involved 50 patients with dry mouth, some of them with Sjogren's syndrome, and put them in a placebo group and an active group, and what we found is tremendous separation, where folks that actually received the MighTeaFlow product, MighTeaFlow lozenges, had increased salivary flow, their mouth felt better, their mouth had better pH, and their dentition was more stable. And so we've seen a tremendous amount of positive results, and we only expect that to be more so as we move forward with additional clinical trials.